Welcome to our fourth and last panel discussion on evaluating safety and effectiveness of treatment, East and West. I am Manilee Araune, a pulmonologist from Davao Province. For those of us who were here this morning, we were able to listen to Dr. Vincent Balanag give an overview of Western medicine, and Dr. Jaime Galvestan demonstrated to us how he would apply his knowledge of Eastern medicine to manage an actual patient who has COPD. Now, for this panel discussion, our objective, as mentioned by Dr. Bing, is to understand how safety and effectiveness of treatment is evaluated from a Western and Eastern perspective. So for our panelists, our first panelist finished her pre-med course from this institution and her medical degree from FEU. She trained in OBGYN at the Makati Medical Center, and she ranked 7th in the diplomate board exam in OBGYN. She had been practicing as an OBGYN physician in a conventional medical practice for 6 years. The following years up to the present, she adopted a holistic approach to health, which really resonated with her. She's a professional ballet dancer until her 2nd year of medicine proper, and is a practitioner of meditation and a breastfeeding advocate. She's a devoted wife to an engineer and a hands-on mother to her sons, Nico and Leo. So let us welcome our first panelist, Dr. Cheryll Sibayan, to talk to us about her views on alternative medicine. How is it evaluated based on its treatment safety and efficacy. For our second panelist, he finished his medical degree from this institution, UST. He trained in acupuncture in several Asian countries. He also has a master's degree in developmental management. He is the first Director General of the Department of Health, Philippine Institute of Traditional and Alternative Health Care. He is also a consultant advisor of the World Health Organization. Presently, he is a lecturer in various medical schools in Manila and the current Vice President and Board Member of the Philippine Academy of Acupuncture Incorporated. Our second panelist, let us welcome Dr. Alfonso T. Lagaya. May I request our panelists to occupy the seats on the stage. First panelist, Dr. Cheryll Sibayan. For our third panelist, he finished his medical degree from the UERM and his fellowship in pulmonary medicine at the UPPGH. He is our very own immediate past president of the Philippine College of Chest Physicians, a member of the Council on Healing and Alternative Medicine, a consultant of the University of Perpetual Health Medical Center, and the treasurer of the Philippine College of Physicians. So our third panelist, let us welcome Dr. Chad Ray Carungin. So the first one who will give his talk will be Dr. Cheryll.
I always believed that we were created to be well and not to be ill. For so long, I have already forgotten this age-old teaching, physician, heal thyself. Behind my white coat and my scrub suits, I was also a patient at the same time. But I was so embarrassed that I cannot heal myself. I cannot treat myself successfully as a doctor. I was diagnosed with so many diseases, like recurrent cystitis, constipation, nodular non-toxic goiter, hyperthyroidism, fibrocystic disease, polycystic ovarian disease, endometrial polyp, and multiple myoma uteri. I was wondering why I have all these diseases, and I cannot understand why my body cannot heal. So, what is really disease? This is exactly a lack of ease and comfort that our body is supposed to be experiencing. All throughout my medicine years and up to my medical practice, private practice, I used to have this, I used to experience this kind of discomfort in my day-to-day life, especially every time I see my patients. During my first 6 years of practice, I noticed that more and more drugs are being withdrawn from the market, maybe because of new discovery that they found that it has lots of side effects, and more patients keep on coming back with the same problems. Patients with so many complaints, but all the laboratory tests are still normal. These are all the questions that keep on bothering me. And I was so disappointed that every time I see these patients, they're still complaining of the same problems. Am I just really curing the patient? This is what the doctors are called upon to do. But usually it uses external treatments to mask or eliminate symptoms. However, it does not address the imbalances that contribute to the symptoms. Or am I really helping them heal themselves? Natural process, this is a natural process, and it is within the power of everyone. It goes deeper and must always come from within. And at the same time, it addresses the imbalances that underlies the symptoms. With this kind of, in my mind, it came to me that I should try the holistic approach to diseases, not only pertaining to the physical symptoms of the patients. The first step that I usually apply is first, of course, I have to identify whether this is an emergency case, whether it is acute or chronic, and then does it need any drugs, surgery right away, or request for the laboratory test? We have to accept that conventional medicine is unparalleled in its ability to deal with emergencies and severe symptoms. Next, this is the best time for me, after evaluating that the case is not an acute or emergency one, this is the best time for me to impart to my patients to change the way they think, help them change the way they think about their bodies. This was not taught during our medical school years, no? We have to understand that we have trillions of cells in our body that are always finding and seeking balance no matter what. But we have to understand also that our body has the innate power to heal itself, but this is the catch here, only if it is in the relaxation state and not in the stress or fight or flight response. Our body is capable of sending signals and messages. These are the things that we usually miss out as a doctor. We automatically treat the symptoms right away without understanding the whole being of the patient. Step 3 is I always tell my patients to balance these 4 factors. Always, I noticed that during my first 6 years of practice, I only focus on the physical side. I missed these 3 factors, which are also highly contributory to the healing process of the patient. But I will be focusing more on the physical factors because these are the main thing that I usually encounter in my practice. This is where the healthy active lifestyle, which is 80% nutrition and 20% exercise, and the poor nutrition and the high body fat percentage are the 2 most common causes of gynecologic problems. So I'll be focusing more here. So we understand, we know already that obesity has been already an global epidemic. And this is how the evolution of our health is already looks like. Well, in the US alone, the sales of the wellness industry has already reached $200 billion and is expected to reach $1 trillion in 10 years' time. And just imagine, we have already the obesity staging score. I thought it was just only seen in cancer cases, no? But these are the questions that most of my patients ask me every time I tell them to lose weight. Why is it hard to lose weight? Why is it that the older we get, the harder it is to maintain weight or lose it? Why is it that even if we work hard, work out every day and eat low-fat foods, we still don't lose weight? The answer is in the small intestines. It is in the villi. So it's just simple as this. It's in the villi. Imagine a villi, and it is damaged because of stress, alcohol, smoking, preservatives, airborne toxins, medications, fats, refined sugars, and salts. Of course, all of these are being absorbed in the villi. And then there will be definitely decrease and poor absorption of the nutrients once the villi are damaged. And then you would notice once there's decreased absorption, the body thinks it is in the starvation state. And then surely it will store more fats instead of burning it. And another thing, the body gets tired easily, and that's where you increase your appetite and cravings. So the main culprit really is a villi that is damaged by our day-to-day lifestyle. Imagine you have the green smiley face here, your nutrients, and then the red mark here, which represents your toxins and bacteria. The villi, as we feed our villi with healthy diet, you would notice that our villi is capable of cleansing or removing those toxins and bacteria in our body. That's how beautiful our body is, no? And then this is what you call the cellular nutrition concept. Once the villi is cleansed by introducing healthy lifestyle, there will be good absorption of the more nutrients, and there will be regeneration of healthier cells. Now, I'll be discussing more on the weight management, which is the main goal is really to achieve and maintain not only a healthy weight, but also a healthy shape. So now in our clinic setup, what we're trying to use is basically body mass index as our guide. But personally, I go for body composition analysis. You would notice when I see patients presenting with infertility problem, she's obese, and then that's the best time I could try starting putting her on weight management. But some patients, they look heavy, but when I put them in the body composition analysis, I thought that based on the BMI, they're overweight, but on body composition analysis, they have high muscle mass, but their body fat is normal. So that's still normal, and that's still healthy. So body composition would really help us also in our clinic setup. The body mass index is used for clinical guidelines only, but it does not correlate well with the fat mass in both over-muscled and under-muscled sarcopenic patients. And it does not reveal any differences whether it is a visceral or subcutaneous fats. And of course, generally at any given BMI, women has higher fat percentage compared to men. For body composition analysis, well, it uses the bioelectrical electrical impedance analysis. It measures the impedance or resistance to the signal as it travels through the water found in muscle and fat. And of course, it determines the body fat percentage, muscle mass, body water, bone mass, and metabolic age. This picture, of course, looking healthy doesn't mean we are healthy. These twins, they have the same BMI. But you would notice the one on the right, he has a higher body fat percentage based on magnetic resonance imaging. So the one on the left, he has the 9.1% body fat. He looks bigger, but you would notice he has the lesser body fat. More muscle. So it is not simply the weight that determines health, but what is important is the quality of the tissues, whether it is a lean versus fat. Okay, we have to remember that for every pound of lean body mass, your body can burn at least 14 calories. So as we age, syempre, the body mass goes down, so that's why we gain weight as we age, because lesser exercise also, that's what's happening. Which is the most unhealthy meal? Is it the breakfast, lunch, or dinner? Aba, nung medical student ako, I don't care. Medical residency, I don't care. Even private practice, I don't care. Because we're always rushing. Diba? But the unhealthiest meal is in the breakfast. But do we really bother to take time to prepare for our breakfast? No. We rather skip because we rush all the time. Okay? So how do you feel first thing in the morning? So this is what I didn't learn before. We no longer recommend carbohydrate-based breakfast. We can take loads of carbohydrates first thing in the morning if we will be working in the field. We are construction workers that we can burn it, but we will just sit down in our clinic and stay there for how many hours? What usually happens in the carbohydrate-based breakfast, this is just a normal blood sugar. After refined carbohydrates, high glycemic index food, your sugar goes up. It's converted to sugar, and then insulin will follow, and then it will lower it down around 9:30 to 10:30. You're hungry again. You're low bat. You cannot focus. You're sleepy. So that's where the break time in the clinic or in the hospital comes in. What will you take again? Carbohydrates again. Shoot up the sugar, insulin will follow, and then it goes down again, and then you'll take another carbo. So with a carbohydrate-based breakfast, you would notice you have lots of cravings. And over the day, how many cravings? 3, 4, 5. Good thing kung wala ng midnight snack. Diba? But if you're studying like a medical student, you have 2. Diba? So as you keep on repeating this cycle, you would notice that insulin level gets depleted in due time. And then these are the major reasons for diabetes, hypertension, and extra weight. Even if the quality of carbohydrates is also very important. And sometimes we do this also, skipping and carbo-based breakfast. Of course, your sugar is low, and then you'll you load up your body with high one-colored carbohydrates, your bread, rice, pasta. These are all one-colored carbohydrates, high glycemic index food, and then you would notice there are more cravings if you skip. Still, the major reasons for diabetes, hypertension, and extra weight. So it's not basically just family history. We were taught that it's just family history and exercise, but also the timing of your eating. Okay? And what is a good breakfast ba? It's basically balanced protein-based. It should be protein-based nowadays because if carbo-based, we're no longer during the times of our grandparents that they basically work in the field. But now, a protein-based breakfast is very promising. Is considered as one of the good breakfast. Actually, the good breakfast. Imagine you have here your normal blood sugar level. If you're just taking the protein-based breakfast and your insulin level is within the normal range, And then you would notice that there are no dips. You have no cravings. Your cravings are much lesser because protein satisfies your hunger longer than carbohydrates. So with this kind of breakfast, there will be less cravings for carbs, snacks, chocolates, and the body uses its own stored fats to get more energy. That's why you lose weight also. Okay? So next, here. So what are your options? This is what I usually tell patients. You can either prepare your own protein-based food, no? Eggs, chicken, lean meats, fish, soy products, or veggies. But some patients would ask me, Doctora, can I just take veggies? Remember, for the vegetables, you have to know how to complement each other, no? Kasi sometimes, let's say a carrot lacks in a certain amino acid, and then you have to mix it with another. Kailangan magaling ka sa combination, complementing, no? You have to have that time. And another thing, the challenge lang here is preparation. If you have time to prepare, then do it. And then, but some patients cannot. So these are the alternatives, which are your protein meal replacements, like your shakes. This is a balanced, complete meal. It's a meal replacement. This is it has zero trans fat, zero cholesterol, low glycemic index, and very, very easy to prepare. You can blend it with fresh fruits or veggies if you want, but basically it's in a form of a shake. Okay. According to the Institute of Medicine of National Academy of Sciences, daily protein requirement is 10 to 35% of total caloric intake. But according to USDA, it's only 10 to 15%. So always remember that protein requirement should be individualized. The actual daily protein consumption, if you're just an average adult, you're not an athlete, no? It's just 0.8 to 1 gram per kilogram body weight. For example, you're 50 kilos. You need only 1 gram of protein every day. Per 50 times, okay? 0.8 to 1 gram. That's for the average adult. And then for athlete, it's much higher, and weightlifter. Okay. The average calories intake per day, men, you know this already. Women, up to 1,600. I noticed in our institution, some doctors would cut down calories way below 1,200, even 500 calories. I don't know if you know the one with, there's a certain thing that you put under your tongue, and then they have to eat only 500 calories a day. Well, for me, it's just unhealthy, no? And protein-enriched meal replacements, these are protein. Remember, protein can satisfy your hunger longer than carbs. And this is the current USDA recommendation, which is very low compared to the Institute of Medicine, 10 to 35%. A practical guideline is just 1 gram of protein per pound of lean body mass. And this can be used also to lose weight, to gain weight, or just to maintain weight. Okay, let's try to look at this traditional meal. Usually, the excess in calories to Breakfast time, you have 1 cup of rice, 1 egg, longganisa, and lemonade. So that's around 750 plus calories. Just reminder for men, how many calories a day? Diba? Parang 1,008 to 2,000 calories for women, up to 1,600 lang, no? So this is 754 calories for lunch. You have your Big Mac, no? Big Mac, fries, large soft drinks, ice cream, 1,600 calories. And then your merienda, of course, your popcorn and soft drinks again, your 625 calories. And for dinner, okay, 1,005. So you've got a total of 4,100 calories. Traditional lang to, okay? So now, let's see how protein meal replacement works. If, let's say, for the 1 meal replacement, we'll change the breakfast to a healthy one, which is a protein-based. Let's see there, you would notice that you change your breakfast to a protein shake or protein food if you want, green tea, fruits, no? And lunch, okay, you starting taking vegetables and lean meats, brown rice this time, colored carbohydrates instead with one colored carbo. And then of course may merienda, may cheat day, di ba? Oo, para namang hindi masyadong sad during the day. And then dinner, of course you have still your chicken wings and lasagna, may rice now, may lasagna pa. And then you've cut it down already to 200 calories, di ba? From 2,000, no? From 4,000, it went down to 2,400. Okay, how about when if we'll try to replace it with 2 meals, breakfast and dinner? See? You would notice, may merienda pa yan, ha? We replace the dinner and breakfast with protein-based, and then the total is 1,700. That's how protein meal replacement works. Okay? Studies have shown already that protein-rich diet makes you lose more fat mass, which leads to more weight loss compared to conventional diet. So here, this is the conventional diet, fat mass, and then protein-rich diet. This is according to the trial from Germany, no? Okay, so let's go to case presentation, a short presentation, case 1. A 41-year-old, gravida 2, para 2, BMI 21.9, normal. Negative diabetes, negative hypertension, unhealthy diet, regular exercise. Positive family history of hypertension and hypercholesterolemia. Diagnosed with hypercholesterolemia, but she refused to take statins. So how did I manage this? Actually, this is my personal history. This was me. I don't like taking statins. I told my cardio, can I change my lifestyle? Okay? So with this, I tried to incorporate protein meal breakfast. Then after a month, it's normal. Case 2, there. Newly gravid, vaginal bleeding, and then patient refused biopsy. How many more minutes, Doctora? Time. Okay. So these are the cases, no? Okay. Mental and emotional factors is very important also, and then spiritual factors, of course. Life's purpose, the whisper of your soul. And then to my fellow doctors, our words can have the power to harm and to heal our patients. Okay, let us help our patients awaken the healer in them. It's very, very important. And the best medicine is when the medical science is combined with our hearts and with our minds. Thank you.
Magandang hapon po sa inyong lahat. How are you doing so far? How's the bombardment of integrative medicine into the minds and hearts of the veteran doctors and the graduating medical students? Okay. Gandang araw po, Dr. Ivan. Do you know he's my teacher way back? Dr. Farkash, my good friend, Dr. Rabing. So, okay. I was asked by the chair for me to speak for 10 minutes now. Let me time my talk with my timer here to ring me up in 10 minutes. Hopefully, I comply. All right. So, at the end of the tunnel, what do I wish to attain? One is for us to become an integrative medicine doctor, primarily. So that's my goal. And one of the things that we learned here in the Royal and Pontifical University is to become very much holy. And from the Catholic perspective, but please be aware that from my stand as formerly from the Department of Health, we cater to all walks of life, including the non-Christians. So, okay. So this is one of the talks I presented to the Philippine Academy of Family Physicians. And I told Dr. Rabing 10 minutes, wow, it's too much stress on both the audience and that for me. So my goal is now to give an evidence-based benefits of acupuncture. And what would that be? Okay. What I plan to discuss now would have to be what is acupuncture all about. Although I heard this morning Dr. Miguel Dans gave you a nice presentation of it. So way back with the Yellow Emperor's Classic of Internal Medicine, way back 100 years before Christ, we have what is the stand of WHO. what is the son of the counterpart of my office, which is in the Department of Health, the U.S. National Institute of Health. We also have what is happening on the other side of the globe, the British National Institute of Health and Care Excellence. What's happening to the down under, the Chinese Medicine Board of Australia. We hope that at the end of my talk, I would be able to discuss some of the relevant researches that you as a pulmonary care, cardiothoracic care doctors would be able to integrate now and in the future. So if the demo allows, we will do acupuncture for ang mga doktor takot sa karayom, acupressure for those who doesn't want to. Okay. Sa inyo ako nag-aral. So, my goal here is to make us as attractive as Alden and to become as beautiful as Maine so that we'd be able to last the test of time. Doktor tayo, tinitingala tayo ng mga pasyente, dapat we should be practicing what we're preaching until we reach the age of golden years hanggang sa maging ganito na tayo in the long run. So, there's a lot of exercise that happens and this I would like you to feel. I always teach this to the graduating medical students. For those who pass through preventive medicine, patanong nyo na lang anong details dito. So may I ask you now as a kind of a breaker, which I'll tell you the scientific basis later. All of you please in your sitting position, extend your hands please. Thumbs up. Fear your hands. Thumbs down. Right over left, palm facing each other, fingers locked. Pull in, rotate, extend. Aray ko po, aray ko po. Alright, don't open it. Pull, rotate, lift up. You'll do it for 3 counts. Okay, second, stretch. Aray, pull in, rotate. Kalabaw lang dok. Okay, and third, pull in, stretch out. Compare the third with the first. You will notice that it becomes more loose compared with the first one. Again. Thumbs up, thumbs down. A while ago we did right over left. Now let's go left over right. Lock. So pull, rotate, extend. Which one is more painful? Is it the right or the left? Pull in, rotate, lift up. Second, pull in, stretch out. Second, pull in, rotate, lift up. And third, pull in, stretch out. Third. Pull in, rotate. Sorry daw. Hindi man ako tinawag dito. So, what is the scientific basis of this? We all know that when we do history taking to our patients, the patient has angina, and the patients would have chest pain radiating where? Left or right? Almost always on the left. It also happens on the right, but almost always on the left. And if you're going to be asking the patient, the one that your patient will tell you is they would have that feel of pain radiating on the ulnar ventral side until it reached the last 2 fingers. Explain why. Western medicine cannot explain that. But in Chinese medicine, we have a heart line that goes on the ulnar ventral side, last 2 fingers, and we have a right heart line and the left heart line. That only shows that there's a meridian flowing in, and if you are having problems with the right over left, that represents heart pumping to the right side of our circulation, primarily the pulmonary circulation, which our pulmonary specialist would be nice to do to their patients themselves. And if you're pumping blood to the right side and there's a discrepancy, weak lungs, whatever it is, infectious or not, we have bronchial asthma, or we plainly lack exercise, there will be pain on the right over left. Si Dr. Ivan kasi super yaman yan. Kaya wala nang ginawa kundi nagki-clinic, sa kakalimutan na yung exercise. Now, left over right is more dangerous because that represents blood pumping to our systemic circulation, and that represents BP or ECG abnormalities. Experiment on this. Don't take your word for it. If you have a patient who has a high blood pressure, let them do this on a regular basis. Probably after 2 to 3 weeks, check the BP again, and you would see the trend of it going down. ECG also the same thing. And if there's a correlation between integrative medicine like this and the prescription that you do to your patients, we're in business. So this is what I share to all patients. Bago mag-aral, bago mag-review for the board exam, for the Revalida, please do this because in Chinese medicine, this also represents a pathway that goes to the brain. Ituro sa mga anak, ituro sa mga pamangkin because that will be good to enhance brain factors. At the same time, it prevents senility. So, I give this to the Philippine Academy of Chest Physicians. Some of them are doing a video just to check it out. And then some of them can do it, some of them cannot. There's a lot of issues here that I would like to discuss. By the way, you're looking at me. I'm having a scarf. I always wear a scarf. Not for fun reason, not for vanity, not for any forma. There's a scientific basis why this needs to be done. For those proponents of good health and good looks and youthfulness, I'll tell you if time allows in the question answer forum, I will tell you what this is all about. All right. So I want you to be swinging from one branch to the other, which is now impossible in Metro Manila. We should be walking. So exercise for the shoulders, exercise for the hips. All of my patients who came to me with breast cancer, the first thing I asked them, did you have frozen shoulders? All of them tells me, 1 year before they were diagnosed to have breast cancer, they had frozen shoulder on the same side as the breast pathology. Is there a correlation? Yes, in Chinese medicine, yes. We see it 5-10 years before it manifests in our ancillary procedures. So, every time we look at shoulder problems, and there would be some kind of an ecchymosis brought about by some of the procedure done as cupping, which is ventosa in the provinces, there would be a problem with the circulation to the lungs. And since this is a pulmonary specialist group, then if you want to enhance on lung enhancement for the problem, then move the shoulders as much as you can. How do you do that in Metro Manila where there's no more branches for us to swing in? Just do some exercise, what I've told you, or a simple exercise by putting on a wrist weight and start swinging your arms on a regular basis. So simple, but something to enhance on circulation, heart, lungs, thyroid, and that of the breast. So, we've exhausted all conventional measures. One last desperate option is to put you on alternative natural medicine that has a 96% success rate. Who said? If a doctor like us here presenting in front of you, maniniwala ka kasi mga doktor na yan. Pero kung mga alanganin mga tao, and during my time when I was still working with the Department of Health, my level as a Director General, also known as an Undersecretary at that time, people comes to me with all their inventions. I remember one patient, one therapist, albularyo. Doc, alam ko na ang gamot sa AIDS. O paano? Minamasahe ko lang. I'll tell you later, there's some truth to that. Unfortunately, I asked him, sige, paano natin gagawin? Kuha kayo, Doc, ng AIDS patient. Sige, tatawag ko. Malapit lang. At the time, my office was at San Lazaro compound. Tawag ako sa San Lazaro. There's with the AIDS center there. Doc, pakitawag ho si Sarah Jane. At the time, buhay pa si Sarah Jane. At depende ho kung sinong available, itatawag ko. Doc, si Sarah Jane lang kung gusto kong gamutin. Okay. Sige ho, tatawagan ko na lang kayo kung makontak ko na lang siya. Hindi ko na siya tinawagan. So there's a lot of people that comes to my office with products, with gadgets, with procedures, and I tell them, totoo ba yan? It is just 10 years of working with the Department of Health that I came out with a seal. What is my seal as the Director General to tell that that product is good or not? Prove to me it is safe. Prove to me it is effective. Prove to me it's affordable. Prove to me it's legal. Okay, let's break it down. Safe. There could be a lot of folkloric testimonials. And you hear from them. In fact, some doctors will even tell you this is good, this is not good. Well and good, it's testimonial. But can you come out with an LD50? Little dose of that particular product at 50% of the target animals. Pharmacologist, you pass through that, alam yung LD50. Effectivity. Folkloric testimonials. Well and good. That's the start of a research. But is there really an evidence-based? Clinical and preclinical, 10 minutes na? Bilis naman. Totoo ba yun? 3:33 pa ako doon. Bibilisan ko po. Alright, ED50. Affordability. I always contest. Doc, ang product ko mabisa. Sige, prove to me. There's a product worth 800 pesos per bottle at 45 servings. But there's another one at $300 at 30 servings. So which one is more effective per day or what? So, I contest them. Okay. Medyo mahal. Okay. And legality. I always bounce it. So, if doctors starts receiving a lot of information that this product is good or not, then ask about pharmaceutical and therapeutic claims of proof that it is safe. FDA would tell you that. If it's a pharmaceutical or nutraceutical, there's two different aspects to it. Okay. Now, Dr. Ivan does this. Dr. Parkas does this. Okay, mga pulmonologists have a lot of ICU patients with only one patient connected to each one with all of that to one patient. May pera ba yan? Sana. Kasi we also can be operated on. Would you know that a lot of my doctors that I've trained, most of the doctors that I've trained, mas matanda pa sa akin. They are OB, they are surgeons, they are anesthesiologists. They come to me, I teach them how to do acupuncture. And then occasionally, unfortunately, it happened, their children would have clinical signs and symptoms of appendicitis. We all know those classical signs. So, refer back to the hospital, but during the time of transport, they do acupuncture. Upon reaching the emergency room, equivocal. Admit for 1 day just to observe. Almost always, discharge. As long as you catch the patient on the appendicitis has 4 stages. Know that? Okay, the first 3, if you catch them on the first 3, you would reverse the edema happening on that McMurdo's area. Believe it or not, but there's a lot of things that physicians themselves can attest to. May pera ba ang pasyente? Why not? $500,000? Why not? Pag hindi, bring them to a hospital. Accessible ba yung hospital? Eh, paano pag ganyan na yung hospital natin? Ilang beses ka na nagsabuan na pupunta dito. So, we come out with the barrio doctors. I don't know who among our 4th-year medical students would ended up in the barrios. So, you end up with clinics, and we have now WHO issues. So, for 1 minute, how can I pass by all the different studies of the WHO, all the different National Institute of Health findings, all of the British things that comes in, Australia coming in, researches of acupuncture to rats, within they simulate brain problems. From this graph alone, without me explaining details, some of them are control, some of them are actual control without any intervention, and intervention doing acupuncture for this. And just alone, you would see the perfusion happening to the brain. Okay, evidence-based. Conclusion, it has an efficacy therapy for ischemic stroke, and its manipulation is a vital influential factor on acupuncture effect. Studies by your counterpart. The Philippine PCCP has the American College of Chest Physician. They asked me to give a talk like this when it was held in Sofitel way back. So they came out with a study of these lung therapies for integrative oncology, and they came that some modalities as acupuncture, massage therapy, mind, body, herbs, botanicals, exercise, etc. Acupuncture assists the control of pain and other side effects and helps reduce levels of pain medications required. Trials of acupuncture for chemotherapy-induced neuropathy, post-thoracotomy pain shows promising results. Okay. It's already 000. Let me share it with you. If you have patients who have any problems with the lungs, since this is a PCCP convention, whatever it is, bronchial asthma or what, I want you to press on your patient or to yourself. Please. This is the point of the hands. Adduct the first and second fingers. There's a muscle mound. Press on that. You can do it yourself. Brave souls can do acupuncture, but of course, that needs a lot of training. Press on that. And then try to compare the left with that of the right. If there's some kind of a pain more on that side, press on that more. If you can do that to your patients. It's a lot of effects. One of it is it has a sedating effect. It will release endorphins, and endorphins will calm the patient. You also need to work on the lungs. By the way, the pulmonary specialist, please take note at 4 a.m. in the morning. Usually, there's a lot of erratic changes on the oximeter and other pulmonary manifestations. At 4 o'clock in the morning, in Chinese medicine, 4 a.m. is the hour of the lungs. So, may cycle po yan. Please, for those having asthma or weak lungs, feel your clavicle, mid-clavicular, slide it down. So the first intercostal that you can feel, which is actually the second. Okay, so the second intercostal space, feel it, and try to feel which part gives you a significant pain. Aray. Okay, so with that, it coincides now with the exercise we did. Try to press on that point. It would be nice to tell your patients, since for the doctors, let them press on it, but for our patients, I ask them to wiggle the elbow so that they massage that point and see whether how much puffing of that bronchial asthma medications that patient will do from today onwards. experiment on those. Those who have asthma, experiment on that now. So, in the Philippines, we have a lot of issues. Just to plug to you, December 3, we have Dr. Jaime Galvestan is there. I am a speaker also on that. Some of the doctors will be talking about these things. So at Lung Center of the Philippines, if you're interested, by all means come in, because the topic of my lecture on that part would be how to develop your acupuncture clinic in the charity ward, in the private clinic, or tapping international organizations as WHO, UNESCO, OCHA, ADB, and so forth. Okay, so these are the things that I discussed. 10 minutes na po. Even though I only discussed 1/3 of my lecture, I have to stop to give due respect to the next speaker who is equally as good as the first speaker. Maraming salamat po.
So, thank you for being kind to the last speaker. And of course, the benefit of being the last speaker is not to duplicate the lectures that were presented this morning, but at least to summarize and point out the things that we missed. How many of you have been in the morning, since the morning? Okay, so we'll try to skip the things that you already know. Next slide. Okay. So evaluating safety. Just like what Dr. Cabral has mentioned, we have the science of efficacy. We also have the science of safety. So being a science, we should have what we call a platform for it. So this is what we call the components of healthcare, which is what we call the safe system design. For every system, there has to be a structure. And I believe in our country, we have an informal cooperation of these particular structures. The first one would be the medication itself. Of course, where do you see it? It's in the PDF, memes, online information. The FDA is mentioned several times during the lecture this morning. Regulatory agency that approves the drug per category and identified population. And then the drug manufacturer who distributes but asks certificates of quality and safety to novel drugs and bioequivalence to those who are actually issuing generic drugs. The prescribing physician, the specialist who assesses the drug safety and effectiveness, the hospital or the outpatient pharmacy, safety policies and outcome reports, and the last would be the patient, his experience or her experience and the measured objective parameters. So with each type of component, there's what we call the elements. The principle of the system they follow is what we call standardization. Everybody has to have a standard. You should refer it locally or internationally. Everything has to have a checklist, meaning they have lists. You can see it on the internet. You can see it in your mind. You can see it on the patient's eyes. There's always a checklist that they have to follow. And the last important thing would be you have to change if you made an error. Because a clinical practice guidelines cannot last forever. It's usually every 3 years that we have to change it. Okay? So there has to be the 3 principles that you have to follow. So the first one is the drug. So pharmacologic, what we mentioned before, the randomized controlled trials, real-life trials that you've been hearing lately, observational trials. And then for it to be a drug, there has to be a dose. No? It has to be for a specific age, sex, ethnicity, and of course the drug trial is important for that. So this is the point of view of the drug. No? So specific dosage forms, document generic equivalence if it's approved by FDA, the routes of administrations, which is very important, document safety issues like adverse reactions, contraindications, drug information regarding pregnancy and risk factors. Now, from the point of view of the FDA, what they do is what we call the 5 elements of what particular component. First is their tasks. The person who does it, the tools and technology that they have that they can do it, the physical environment where they have challenges that will stop them from doing it, and the organization, which is the culture, whether they'll continue it or change it. So these are the things we have to look for. So the FDA checklist is available online. It's pretty lengthy, I think about 3-5 pages. And then periodically review. It means it has to terminate at some time. It's called self-limiting, no? And expiring certificates of approval. You cannot certify a drug forever. You have to actually check it once in a while. You monitor and act on reported adverse effects for violations. So they have a tool and technology for this one. And perform drug testing. Of course, FDA admits they cannot do drug testing for everything. So if the patient and the doctor doesn't report it, it will go unchallenged. So the drug will still be in the market and will be sold as such. So these are the tools and technology. For the drug manufacturer, of course, they mention as part, healing is a business. Of course, we want to be in the process of healing. So the healing process involves the drug manufacturer as our partners for developing drugs. And like the linear, what we call event for every 100 researches, you get 5 for human trials, you get only 1 approved. So you see the amount of money, of course, they want to have a return of investment for it. But again, you look for the ethical standards that the R&D presents to the, what we call the environment. They apply for FDA, they have bioequivalent studies, they have ethical dissemination of information to medical practitioners. This is also their job. Meaning, their recommendations which should be based on clinical trials. Now, there's what we call off-label use. That's what, like Dr. Moral mentioned. They do not encourage it and should not encourage it, although it's always there in the drug information sheet. And of course, box warning is very important as their duty, to the one who's going to buy it. The physician. Ours is one country where the physician is not only regulated at the GP level, Meaning, one of the countries in ASEAN where the specialist is what we call a private entity, meaning the government doesn't have any hold on the specialist. So, we take it upon ourselves to provide a treatment plan for each patient. Meaning, there should be informed consent, and then you have to evaluate the patient according to their age. Remember, we are treating more elder patients, and as they get older, they have more disease. So, they have what we call in Canada and in the US, the Beers criteria, the prescription for older populations and fit for the ages criteria. So you have to adjust. If they get older, they have more disease. If they have more disease, they have more drugs. So what happens is we use a DUC for each medication. We use a clinical practice guideline. Let's say, for example, COPD, diabetes, hypertension, arthritis. We will have 12 medications. What happens? There is what we call a drug-drug interaction. Now, they're coming up with drug-herbal medication interactions, just what they mentioned a while ago. So you have to review comorbid conditions, the drug interactions, monitored adverse events, and response to medications. So the study of Dr. Balgos is very important because they have to have objective parameters. Objective means something that you can see, something that you can check. And of course, you have to stop withdraw treatment. Our speaker in the first place, you can withdraw treatment if the other modalities work. Diet, exercise, weight loss. So the outcome measures will still be the end factor. Now the hospital, they have responsibilities. It's not the patient only who's what we call does the informed consent. They have to make sure that the patient who's receiving the medication have these. They review the medication errors because it's still manual. For those who have used electronic prescription, it actually makes the error less. Medication reconciliation, you have to ask the patient, are you still taking these meds? You have 12 on my list. Have you removed one? And then adverse reaction reporting, meaning our speaker for Nutri Life, you have to call your patient and report adverse event post-visit. You need to call them up and ask them, we gave you a new medication, how is it? Did you have any problems with it? So that's actually good practice. And of course, updating the drug formulary. The pharmacy from the hospital and the clinic should be independent, meaning if they believe there are too many complaints about the drug, they should present it. And the formulary, what we call a group, should change it or remove it from the list. And the most important one is the patient. His personal experience with drug, and then modality subjective report of outcome. Yet, they also have observed visible physical signs. You should monitor their vital signs. The imaging that you presented, Doctor, a while ago. And then, of course, documentation of cure. This is what Dr. Dans actually mentioned. You have to make sure that based on timing and treatment and ruling out variables, it's the medication that treated the patient. Like giving antibiotics for 3 days for a viral infection is not documented as cure. Okay? So you have to be sure that there are no variables when you treat a particular patient. So it means that there is proof of cure. And then, just like the 6 sides, you always mention 2 sides of the coin. But this one, it's what we call the roll of the dice. And when you roll up the dice, the red one is what? Number. Yung red one, do you play dice? 1. And the center is always the patient. So when you roll the dice, it's not the side of the coin. It's not good and bad, high and low. It is actually a complement of everything. And the last one you have to look at is the patient. So we have FDA looking at the drug manufacturer. We have the FDA looking at the pharmacy and the dispensing units. The doctor talks to the drug manufacturer, and the doctor talks to the pharmacist. Seldom do we have the FDA crossing over the physician. Seldom do we have, but actually we do, pharmacy cross over to the drug manufacturer. So it should be around the patient, and yet it's not interacting or intercrossing, because the patient is the red dot on the dice, meaning is the priority of everything that we do. Okay, so thank you.
Thank you to our panelists. In the interest of time, we have no more open forum. For this panel, we have learned from our first speaker the importance of a holistic approach to our patients, looking at the patient not just on the physical aspect, but as well as on the emotional, mental, and spiritual. Then on our second speaker shared with us his expertise in complementary medicine, especially using acupuncture and acupressure. And our third panelist talked to us about how to evaluate drug efficacy and safety.